lectures. They're reality in any education setting. But what if there was a way to combine the benefits and outcomes of active learning with lecture-based teaching? Hi, I'm Amy Gardner, Associate Dean for Faculty Development and Director of the Academy of Medical Educators here at the University of Colorado School of Medicine. Today I'm excited for you to hear from Dr. Prem Subramanian, Professor and Vice Chair of Academic Affairs in the Department of Ophthalmology and holder of the Clifford and Janice Merrill Endowed Chair in Ophthalmology, and learn with him about how you can transform your lectures with active learning techniques.
Many of us are repeatedly asked to lead an educational session in our area of expertise to a new group of learners. And if you're a busy clinician like me, let's be honest, the easiest thing to do is dust off the old slide deck and give the best lecture you can. Well, it turns out that traditional lectures are time-consuming for everyone and not the most effective way to help learners fully absorb new content. So I'm Prem Subramanian here at the University of Colorado School of Medicine, and I'd like to share with you some tips for transforming your lectures to active learning. Let's start with the basics. What is active learning? For learning to be active, learners not only need to be doing something, but they also need to be thinking critically about what they're doing. Intentional engagement, purposeful observations, and critical reflection are active learning strategies that lead to better retention and application of new knowledge. These are outcomes we desire for all of our educational endeavors. Now, fortunately, incorporating active learning techniques into your existing lecture materials doesn't mean you have to revolutionize your approach. Let's talk about some small tweaks you can make to effectively create moments for learners to be actively engaged with your material. Number one, implement the pause. This simply involves incorporating regular pauses of 3 to 4 minutes. During these, learners will work in pairs to make collaborative notes on the major issue of the lecture up to that point or since the last pause. Ideally, the pauses are spaced out regularly and no more than 15 minutes after you have started each lecture segment. And this is fairly low-hanging fruit to ensure that doing and reflecting are intermittently incorporated into your lecture process. Now, another approach is to incorporate bulleted breaks. This is where you take part of your lecture and distribute it in unordered bullet points of 5 or 6 important issues. You then have learners work in groups to categorize and order the points, as well as to generate 1 or 2 questions they'd like to ask you about the topics. Now, this approach allows for a higher level of doing and reflecting within the context of a lecture period. Now, simply asking questions can also be transformative. Let's face it, when your learners know that you might ask them questions, they listen differently. Engaging learners through questioning transforms passive lectures into interactive learning experiences. You should consider targeted questions in which you ask specific learners direct questions to encourage participation and accountability. Follow-up questions also can be helpful. After a learner responds, ask another to assess or expand on their answer. For example, what did you think of that perspective? Now, this promotes peer discussion and deeper analysis. There are also connection questions, which help learners integrate knowledge by drawing connections between concepts. For example, how is tinea capitis similar to hand, foot, and mouth disease? This fosters critical thinking and diagnostic reasoning. Now, one more approach to try is to turn lecture material into cases for learner decision making. So rather than presenting them with isolated facts, introduce clinical cases and have learners work through diagnostic reasoning and treatment decisions. And this mirrors real-world decision-making and enhances problem-solving skills. Finally, consider tech-based tools like interactive polling technology. You can leverage tools like Poll Everywhere, Kahoot, Mentimeter to check for understanding, collect responses in real time, and then encourage participation. So these benefits can be engaging all learners, even those who may not want to speak up, identifying gaps in knowledge for immediate clarification, and encouraging peer learning through response discussions. So by incorporating these structured pauses, bulleted breaks, interactive questioning, case-based learning, and technology-driven engagement, You will create an active learner-centered environment without requiring a major overhaul of your teaching materials. Try these strategies the next time you're asked to give a lecture to make your teaching more dynamic, effective, and impactful.